Stroke is the second leading cause of death worldwide. So forget about cancer and car accidents for a moment and think about the blood supply to your brain. Right now, is your brain getting enough blood and oxygen? Are you sure? Often, before a major stroke, there is a condition called a mini-stroke, where only a small part of your brain experiences a lack of oxygen and nutrients. Watch the video until the end to learn how to recognize the signs of an approaching stroke and how to prevent this condition. Firstly, let me explain what a stroke is. It is a condition where the brain does not receive enough blood due to a blockage, such as a blood clot or cholesterol plaque. Blood carries oxygen, so when blood flow is insufficient, parts of the brain suffer from oxygen deprivation. The symptoms and consequences of a stroke depend on which part of the brain is affected. This can lead to limb weakness, partial paralysis, slowed speech, impaired perception, and other issues. It's important to prevent a stroke, as it is often possible to predict and prevent it by paying close attention to your body's signals. How can your body warn you about a potential stroke? Symptom number 1. Persistently elevated blood pressure. Persistently high blood pressure or chronic hypertension significantly increases the risk of a stroke. Blood pressure measures the force of blood against the walls of our arteries. When this pressure is consistently high, it can cause damage to the blood vessels, leading to narrowing, weakening, or even rupture over time, all of which contribute to stroke risk. If a blood vessel in the brain ruptures due to high blood pressure, it can cause bleeding, resulting in a hemorrhagic stroke. Additionally, if hypertension damages the arteries that supply blood to the brain, it can reduce blood flow or cause a blockage, leading to an ischemic stroke. Therefore, managing high blood pressure is crucial. This involves adopting a healthier lifestyle and following prescribed medication regimens. These steps are essential to control blood pressure and reduce the risk of stroke and other cardiovascular diseases. Symptom number 2. Excessive fatigue. Excessive fatigue or extreme tiredness can be a warning sign of an impending stroke. While fatigue can have many causes, experiencing intense, persistent tiredness that is unusual for you and not related to physical exertion or lack of sleep could be alarming. This excessive tiredness may result from changes in blood flow to the brain, potentially due to a narrowed artery from atherosclerosis or a possible blood clot. If you feel an abnormal level of fatigue, it's essential to seek medical evaluation. Sometimes, extreme fatigue can precede a transient ischemic attack, TIA, which is a temporary disruption in the brain's blood supply. A TIA acts as a critical warning sign of a possible future stroke. Symptoms of a TIA are similar to those of a stroke, but typically last from a few minutes to several hours and fully resolve within 24 hours without causing permanent brain damage. This occurs when an artery in the brain is temporarily blocked and then cleared, leading to a rapid resolution of symptoms. Pay close attention to this warning. If you notice any transient signs or symptoms, it's imperative to seek medical attention immediately. Symptom number 3. Vision problems. Sudden changes in vision can be a warning sign of a stroke. Blurry vision, double vision, eye problems, or difficulty focusing may indicate circulatory damage in the brain. While various factors can cause vision problems, it's important not to ignore these symptoms. Vision loss can result from the blockage of an artery supplying blood to the eye, often indicating an ischemic stroke, the most common type of stroke. Taking these changes seriously and seeking prompt medical evaluation is essential. Symptom number 4. Sudden and severe headache. A sudden and severe headache can be an early warning sign of a stroke. While not all headaches are related to strokes, and not all strokes are preceded by headaches, it's important to recognize the potential connection. In the case of an ischemic stroke, a headache occurs due to the obstruction of blood flow in the brain, often described as sudden and severe. In a hemorrhagic stroke, which involves bleeding within the brain, the intense headache results from increased pressure inside the skull due to the bleeding. This elevated brain pressure can cause severe pain. People witnessing a stroke often report seeing the affected person clutching their head, showing signs of intense pain, and sometimes losing consciousness. This reaction is especially common in hemorrhagic strokes, where the headache is often described as the worst headache of the person's life. Additionally, A severe headache can also signal the imminent risk of a brain aneurysm rupture. Given these risks, it's crucial to take sudden and severe headaches seriously and seek immediate medical attention. Symptom number 5. Numbness or weakness in body extremities. Numbness or weakness in the extremities, particularly on one side of the body, can be an early warning sign of a stroke. These symptoms may occur during a transient ischemic attack, TI, which is a temporary reduction in blood flow to a part of the brain. This sudden numbness or weakness usually affects one part of the body, such as an arm, leg, or one side of the face, leading to decreased sensitivity. Although these symptoms often last only a few minutes to a few hours, they should never be ignored. Whether they indicate a stroke or another neurological issue, it is crucial to seek immediate medical attention. Prompt evaluation and treatment are essential to prevent a full-blown stroke and address any underlying health problems. Symptom number 6. Speech problems. A person about to have a stroke may suddenly experience difficulty speaking. This can manifest as slurred speech, trouble articulating words, or difficulty forming complete sentences. These issues fall under the category of aphasia, which is the impairment in understanding, formulating, and expressing speech. If someone suddenly has trouble speaking, it is crucial to seek medical attention immediately, as this could be a warning sign of an impending stroke. Symptom number 7. Hallucinations. Hallucinations can be visual, auditory, tactile, or gustatory, meaning any of your senses can be deceived. When you perceive something that isn't actually there, it's always concerning and abnormal. If you experience a hallucination once, it might be due to extreme fatigue. However, if you regularly experience hallucinations and are not taking any neuroleptic medications, the cause might lie in the brain. When the brain doesn't receive enough oxygen, its cells begin to die, sending false signals that wouldn't occur under normal conditions. This is similar to the death throes of cells, a warning sign that should not be ignored. Symptom number 8. Neurological problems. Individuals on the brink of a stroke, whether it be hemorrhagic or ischemic, may exhibit a variety of neurological symptoms. These can include memory issues, loss of balance, as well as nausea and vomiting. These symptoms may manifest a few days or even weeks before a cerebral event. It's crucial to remember, however, that various other conditions can present similar symptoms, complicating the diagnosis process. Conditions such as migraines, seizures, hypoglycemia, brain tumors, anxiety attacks, and infections in the central nervous system, for example, can all elicit these symptoms. It is imperative to consult a qualified doctor for a comprehensive evaluation to accurately determine the cause of these symptoms. Symptom number 9. Loss of coordination. If you haven't consumed any alcohol recently, but find that your hands and feet aren't responding well, this loss of coordination could be a symptom of an impending stroke. The same mechanism is at play. Disrupted blood flow leads to a part of the brain not receiving enough oxygen, causing neuron death. This results in the loss of functions controlled by that part of the brain, leading to partial loss of body control. The body may quickly adapt by finding new pathways for nerve impulses, and your condition might normalize. However, if you notice any of these symptoms, it's crucial to see a doctor and check your brain's blood vessels. Symptoms might appear and then partially or completely disappear. It's vital not to ignore these signs and rely on luck. How to prevent a stroke. Control your blood pressure. If you have diabetes, control your blood glucose levels. Maintain your ideal weight. Exercise regularly. Eat fresh and healthy foods. Avoid processed foods. Avoid consuming sugar, excess saturated fats, and excessive alcohol. If you smoke, consider changing your habits. Sleep well. Control your cholesterol. Keep your checkups up to date with your cardiologist. This will indeed prevent a possible stroke in the future. This concludes the video. If this video was useful, don't forget to like and subscribe to the channel so that you don't miss new materials about health, nutrition, and wellness. Take care of yourself and be healthy. Thanks for watching.